Fellow Ghanaians, now everybody know that we are in a pandemic year or a month. And the measurements are come as the president said that everybody supposed to make sure to social distance to work. Me and my listeners, I want my people to know that this disease is a terrible disease. It's a real, it's active. It's a disease which will catch you, my man. If your immune system is not stronger, there's no way your family will get you. So I want to tell my people that wash your hand with the running water, with this, a good sanitizer. That principle, my man, every home have to obey that instruction. Don't make yourself loose, especially our children. Don't let your children to go out anywhere. Don't let your family to go out anywhere. So as I'm talking to you, that this pandemic we are in is so terrible. So fellow Ghanaians, you are watching my mouth right now. Make sure is that the social distance is more important to cover your nose. My life to me is that to cover your nose is a more important thing. To wash your hands is a more important thing. To social distance. I think that social distance is the main important thing. So as I'm talking to me and you have a social distance here. So anything you are talking, there's no way something from you to me from you can get it. So I'm let them, my people, to know, especially my fellow Ghanaians who follow me everywhere. My brother, the social distance is the main important. If I'm talking everything, I'm mentioning a social distance. So the social distance is more keen. And make sure you're washing your hands. Some people will say washing your hand, didn't wash your hand well. Make sure the running water. The running water is supposed to be every sector to your home. Are you getting me? So if your home is you having water with your home, anytime I'm coming home, I have to wash my hand before I enter.
Well, very funny as it is, but it's also a message that we all need to adhere to. And Gifty, it's more appropriate for the period, knowing that we have to live the new normal.
Yeah. So whether we like it or not, it's here, and we have to do something about it. And that's a conversation that we'll be having. How do we live with a disease, essentially, that spreads as fast as wildfire? That's what we're, bushfire, I should say. That's what we're going to have. That's the conversation we're going to have. We're joined by Dr. Samuel Essien Baidu. He's a microbiologist and immunologist at the University of Cape Coast. We also have Dr. Ruth Owusu Entry, who is head of psychiatry at the Komfo-Anokye Teaching Hospital, also joining us for that particular conversation. Looks like we have three of them. We also have Dr. Christian O. He's a consultant anesthesiologist. That's a very big and a mouthful. And also head of ICU at the Korle Bu Teaching Hospital, also now at the UGMC, National COVID-19 Case Management Coordinator for severe and critical cases. Ladies and gentlemen, you're welcome.
Thank you. Good morning.
Good morning to all of you.
And good morning to your audience.
Great.
I mean, I like to have this conversation by asking you, getting a bit personal with people like you, people who work in the front lines, and to find out how it's going for you. I mean, certainly it's not the same. Any of you can go for it. How about we start with a woman?
Definitely not.
Gender activism. So we start with...
Yeah, Ruth, you want to go?
Okay, we can't hear her at the moment. So, Doc, please go ahead. We can't hear her.
It's not been easy. It's been a bit stressful, but the joy is that you are able to offer some help and support to somebody, and at the end of the day, their results come negative and they are going home. It's been great. It starts with you breaking the news of you have tested positive, and then most of the time, almost all the time, it ends with you breaking the news of, okay, you are well, you have gotten negative test, you have recovered, either you are going home or now you are free from your self-quarantine. So it's mixed feelings of stress and happiness all mixed together. At the end of the day, the joy is that we are joining in the workforce to see that we are able to tackle COVID-19 head on.
Right. I was hoping for a rather personal story, but that's okay. Dr. Wu, let me come to you for your own personal experience so far.
Yeah, Gifty, thank you. I agree with Ruth, it's not been easy. It's changed basically how we do everything, not only with medical practice, but with family life and then finance, economy, and all that. Every facet of our life has been touched. I've had to basically even change how we operate as family, and even and I need to say that family has been extremely very supportive. My wife, the little boy, and going out with uncertainty, you could know what you're doing, you could be sure of what you're doing, but your family are not sure what you're doing. I must say, other aspects of family lives and social life has been touched significantly. I've spoken to my mom almost every day, but I haven't seen her in 8 weeks, which is very unusual even for me. I've spoken to my siblings quite regularly, almost every day. But again, we haven't seen each other in trying to protect each other and then be role model for what we are trying to get others to do. So yes, I intentionally have focused more on what it does to our personal life, what it does to our relationships, what it does to our finance. We're spending a lot more now, even though children may not be in school, but we're spending a lot more on internet, on e-learning, and I'm sure everybody who has a child could attest to that. And we're spending a lot more on cleaning agents that we had taken for granted before. Now there has to be a tissue, there has to be running water, there has to be Veronica bucket, there has to be soap regularly, and you can't take those things for granted anymore. So yes, the new normal is quite different from what the old normal used to be, but there are good things to learn from it. There are limitations that we will be faced with, but that's been personal life in this last 8 to 9 weeks here.
Okay. I mean, it's good for us to have that perspective of how your life personally has changed. So we set the tone for our conversation of how we can now begin to live or even fantasize with the idea of living with this virus. So I'm coming to you, Dr. Asian, as well for your own personal story. Then we can start our conversation.
So thank you. Personally, for me, I think the challenge has been how to adjust to the new normal and particularly adapt to regular family life, nuclear family, extended family, friends, and other relations. That has been the biggest challenge for me personally. You can't go back home hugging your kids like you used to do. You can't give that handshake when you meet friends and all of that again. And so it's been a bit of a challenge, but as Dr. Wu rightly said, we need to also be reminded of the fact that these things have become part of our lives now, and we must do them and be able to help limit the spread of the infection so we can get it done with in no time.
Well, I'm also around, so but let's kickstart this whole discussion on the subject of how we live the new normal by asking you, Ruth, Dr. Ruth Owusu, that, you know, we're coming from a situation where we have intense number of cases being announced. The media is always creating the buzz around the human interest stories, and there's always the psychological aspect of the fear, etc. If we want to follow through what other countries have done, making sure that we adapt our lives with the disease, then it also means that we need to do some level of psyching up people. Where do we start from?
Yes, thank you, Roland. I think it's now very obvious that this virus is going to live with us for a very long time. We should give ourselves a period of 2 to 5 years. And so I started thinking about this quite early in the pandemic. How should our lives go on with this pandemic? Initially, it was how do we avoid the infection? How do you try and stay away from the infection? But my perspective has changed, and I think that is what we should be looking at now. And it should change to how do we live with this pandemic? How do we live with this virus? The conscientization should start right away. People should begin to fit it in their lifestyle. I was just speaking to one of my patients, and I said, you are due for your review. Can you come over so and so date? And the person is, no, I would have to wait till the pandemic is down. I said, no, you would have to find a way to come and still feel safe. And so our education should now include not just the preventive protocols, but to emphasize the fact that we should try and let life go on, even in the midst of the pandemic. If you are following all the preventive measures put up, then virtually you would, as much as possible, stay out of getting infected. But people should understand that that should not stop anything. If you need to go out, take your mask and move. I saw a picture of a lady who had done a makeup and had painted on her mask, wanting to appear as if she wasn't wearing a mask. I mean, everything should move as if there is no pandemic, but as much as possible in the context of keeping all our preventive measures. And so, yes, pandemic is here. I'm not sure how soon schools will reopen, when churches will reopen, when gatherings would be allowed to go on. But when they happen, in the midst of all the preventive measures, we should still be able to function. And I think the conscientization should begin now.
So having the conscientization begin now, let me bring in the microbiologist, Dr. Samolesian. Doc, I would like to find out from you. Now, from the psyching up perspective, we're hearing that, look, whether we like it or not, it's here. And we should put that in our education plan. We don't know what the president is going to announce, but should he lift the restrictions on social gathering, etc., from what you see as the character of this virus, is wearing a mask and washing your hands just enough as yet if we have to incorporate this into our lifestyle?
Okay, so basically, if you look at what we are describing as our new normal, there are two major phases in our new normal, which are the adaptation phase and then the stabilization phase. Now, what we are doing currently is to adapt to what we are referring to as a new normal. Now, in the changing phases of the pandemic, right from the onset, where our numbers increased up to a point, people started dying and all of that, and the introduction of the measures, I think that what we need to do now is to encourage people and educate people a lot more to adapt to this new phase. Now, this adaptation phase would include, obviously, hand washing, physical distancing, wearing of masks, and all of that. And once you can get a lot more people to adapt to this phase, then gradually we can get all of us stabilized, and then we would be able to live with this virus for as long as we wait for vaccines to be developed. So it is important that we maintain these measures as we speak now. We make sure that people gradually understand that we need to adapt to this new way of life. We need to adapt to washing our hands regularly. We need to adapt to wearing face masks. We need to adapt to measures of keeping physical distance from one another and all of that. And once we adapt properly, then it becomes part of our lives, and then we'll be able to stabilize ourselves and live until vaccines have been developed. So
from your answer, I'm getting that we are fine as long as we can keep wearing the mask and keep washing our hands and keeping away from one another. I'm asking this because I heard that this virus has a character of its own as it transitions from one country to the other. I don't know how true that is. If you can help us with that. We're told that it mutates, and so when it gets to the kind that you have, for example, in the UK or in Italy, where a lot more people are dying, isn't the same as what we're experiencing in our parts of the world. Is there any truth to this?
I think the genome sequencing that was done at Legon has clearly shown us that what we have here is not too different from what has been reported in Wuhan and the other areas as well. And for us, that is a good news. We will continue to monitor how the virus behaves and then also inform accordingly if there is a need to change strategies and all of that. And so it is important to keep in line with what the researchers and the clinical scientists are observing in terms of the behavior of the virus and also advising accordingly. As we speak now, we haven't identified any new strains of the virus apart from what we saw earlier on. Okay. And so our strategies necessarily do not have to change as we speak.
Good to know.
Dr. Owu, and since you're now at the center where you tend to see the most critical of the cases as we have it, ultimately it will mean that when there's any resumption of normalcy of life, it would mean that, let's say, critical care for other cases of diseases that we have at OPDs, etc., will still have to go on. And then we have these that could also come in ultimately. Are we likely, based on what you have read, your experiences or interactions with other health professionals across the world, that once restrictions are lifted, we could see a surge? But then, how do we then allay our fears when we see such a phenomenon?
Yeah, Roland. So again, just as Samuel said, there is an adaptation phase, there is a stabilization phase. We speak of the new normal, not purely as a situation where everything goes back to the old normal. And that's why we keep calling this new normal. As Ruth said, this virus may be with us for a bit of a time, but it is what impact it is having that is more important than it's been. There are viruses with us, living with us, causing no problem. Or even when they're causing problems, the measure of their problem is significantly insignificant, in which case we tend to ignore them and live our old life. Now, the reason I'm bringing this up is because it is important to not forget that the vulnerable, and I mean the medically vulnerable in our population, are still at risk as long as there's significant infection and spread. So one of the things we did at the beginning is started thinking about exit strategy. But you can't exit in the middle of people dying. You can't exit when the number of people who are critically ill is still very significant. You have to have a plan to exit. But that means that there needs to be a lot more aggression while you're trying to make sure that those vulnerable in the population, those with what we call chronic medical conditions, diabetes, hypertension, sickle cell asthma, cancer, kidney, liver diseases, that they can also live a life when we say that we have exited and moved on with our life. If not, we can't stabilize. That is important to bear in mind. It also means that we cannot pretend that because it is here with us, that we should allow it to infect anybody and everybody and then find a way of living. Because what that means is we will be chasing herd immunity, and people are going to significantly die. Will our health system be able to absorb that amount of critically ill patients? I am not too sure at the moment. We need to be careful about those. So we need to be aggressive in making sure that we keep talking about blunting the curve or flattening that curve, where, yes, the numbers who are infected are so little that eventually we may be having one or no infection. And China, in the last few days, have had situations like that, even with a population of 1 trillion people. So we need to work at that aggressively while we are at it, get to the point where whatever numbers that are infected are so insignificant that it doesn't cause much problem for our health system. If not, the health system is not going to recover from that. Then we have to plan, how do we manage people side by side? Because we're not going to create new hospitals that are going to be taking care of COVID. No, it's going to still be basically patient an infectious disease, as we've already had in our previous hospitals, being taken care of side by side, and being taken care of by healthcare professionals who should be clear in their mind and confident that they can still work in that environment. We talk about new normal. Wearing masks, washing hands may not be too much of a restriction if you can have the amenities, but wearing a full coverall working is cumbersome. Our health system is not going to change to a system where doctors are going to wear full coverall to see patients. That is why those need to be dealt with, so that we will be able to work. We won't be able to examine patients effectively if we think that that will be our new normal. So that's not what I mean by new normal. New normal is still with the social, with the infection prevention control, with the changes that will happen in our health education, in our medical education and education of health professionals, and the use of IT in what we do. And then the psyching up of people, because even when we say today that there is no infection in Ghana, even for 2 weeks, you may have a difficulty with people agreeing to go back to work, with people agreeing to shake hands, with people agreeing to hug. But eventually we're going to get back to hugging, we're going to get back to shaking hands, we're going to get back to reducing the distance between us. We're not going to, our transport system is not going to survive if in the next 2 years, the gap between people is huge. So all this we need to bear in mind, that when we are psyching people up, we need to create the atmosphere, the ambience for people to feel safe and to be confident to get back to work and to be productive. If not, we'll be running at crazy loss economically in trying to manage a synthetic new normal.
All right. Dr. Ruth, if the decision is being taken to remove the restrictions, we've seen that elsewhere, and I'll borrow the phrase of Gifty here, and she said that the decision and the argument that has dominated, let's say, the atmosphere in the US, etc., has been one of playing political football with that decision for the restrictions to be removed. Now, in our case, for you, the health professional, what goes in your mind when you know you're seeing the real cases, but also a decision politically has to be made by authorities of state that, look, life has to move on? How do you create the balance in there? I start with Ruth. I think it's a question all of you can take, though. But Ruth, you start with it.
Sometimes you feel very worried. You feel that this is a wrong move. But once the decision has been taken and it should govern all of us, what usually happens is that let us find how we can restructure to fit this new decision. I remember when the lockdown was initially lifted, the health professionals were not too happy. We thought that cases were increasing, but the government said it's time to lift it based on several things that were enumerated. At that point, we all have to now restructure, readjust to see, well, if cases are going up, lockdown lifted, what else can we do to curb the virus? And so we live not just in a health system, we live in an economic system, in a political world system, in a world where several other things matter. Somebody may say that, well, if you don't have life, what then is politics? If you don't have life, what then is business? But I've heard people who are saying that if I don't get my economic confidence, if I don't go out and do my business, I might as well die from poverty or from anxiety or from sleepless nights, I'm only worried about my business going down. So one way or the other, it is not just the health aspect that we should be concerned with, but we should look at the overall situation. And so no matter the decisions that are taken by the powers that be, by our political leaders, the health system must find means and ways to adjust and to still continue to fight this pandemic. Initially, it is not easy, but we realize that we have to re-strategize, and probably that is the best means to move forward.
And re-strategizing, very soon we'll open the phone lines and allow you, those of you who are watching at home, to direct your questions to any of our resource persons. What questions you have on your mind, let's ask them and see how we can work this out. Talking about re-strategizing, I'd like to bring in, any of either Dr. Owu, well, let me get to Dr. Essien, about what we need to do. Facility, in terms of our facilities, in terms of our health personnel, if we are accepting that this is something we need to deal with. Dr. Owu indicated that we still have to take care of the other diseases. There is malaria, people have hypertension, people have diabetes, and those people are even high risk. In terms of our facilities and the human resource to fight this in the hospitals, what, from your perspective, do we need to do if we need to live with this virus for, as Dr. Ruth is saying, at least 5 years?
So basically, I think that we also need to relook at our policies in terms of how we work, how our transportation systems work, educational systems, health facilities, and all of that. This is not going to be like it used to be previously. Now, Dr. Wu rightly mentioned that it is not going to be easy for physicians, for instance, to wear full regalia, seeing patient after patient and all of that. We need to come up with innovative think we can go through this phase of stabilization, which is very, very important. A lot of the times you notice that a lot of attention has been given to the public health implications of this pandemic, and very little on the economic implications and the others, the political implications and the likes. We need policy changes in terms of how we work, in terms of how we educate people, right from the school system. Dr. Wu also did mention the use of technology, for instance. Is it possible to innovate?
Looks like we've lost Dr. Essien there, but it's a very important point he makes about policy changes, the necessary policy changes. If we have to live with this, now we need to work it out so that everybody is on the same page. So we are on the same page. We know that if I have to go to work, I have to go with a mask. It's a policy. Right now it's still some way, somehow a policy we're trying to implement. Yeah. So, well, let's get on the phone lines. This is about you, most importantly. Isaac is calling from Ashie. Isaac, what's the question?
Good morning, Gifty. This is Isaac Batum, Major.
Okay, please go ahead.
Yeah. I want to ask our doctors, with the recently discovered medicine for Madagascar, what is their view on that new discovery? What are they putting in place? What is the research they are also doing to ensure that this thing Madagascar has discovered can also help Africa in general? Thank you.
Thank you very much, Isaac, for that question. Do not call the WhatsApp line. We put the WhatsApp line there. It's for a message. So do text us. We'll ask the question for you. Don't call. You can call the phone lines, by the way. Roland, who do we give this question to?
We give the question to first Dr. Owu, and then we'll go to Dr. Esiembedu for it. Dr. Owu, please start off with all this.
Yeah.
Madagascar.
Yeah, thank you, John. There are a lot of researches that are going on, and it's not, almost every country is trying to see what works and what doesn't work, just as well as vaccines are being created as we speak now. Yeah, we know vaccines take a little while before we get to the phase where we use it for human beings. And that, I mean, if we're able to get vaccines now, it reduces a lot of the cumbersomeness that is associated with this. The Madagascar medication, it's difficult for me to speak expertly on it because I think part of what is happening now is there are tests going on, including in our country, on it, and then by WHO to see both efficacy, its ability to do what it says it does, and then to find out what effect, i.e. side effects, it may have. And these are things that are done with every medication that are licensed to use in any country. So that is as much as I can say about that. We will be glad if this works and if it is safe for use, just like any other medication that comes from the West. If this is coming from Africa and it works and it does not cause adverse effects on our patient, it will be fantastic. We would be among those to go for it very aggressively to treat our patient. But we're not yet there at the moment. So that is as expertly as I think I can speak to the Madagascar drug at the moment.
Well, Doc, we'll come across to the rest of you, but I think that we have about two more callers on the line. Let's take their questions so that we have three to go, and then you answer, you speak to that. So I have Roberto from Enu. Roberto, please go ahead. Oh, we lost both of them. So sorry. You can call again.
Okay, so Dr. Esiembedu, the point about having medicines from other sources beyond just the orthodox.
I think basically we need to be very cautious in that approach. We need to review critically what these medicines are, whether there are contraindications, whether they would have other effects on the people who would take these medications and all of that. So it is not just a blanket. We need to be very cautious what we use in managing these patients. For instance, now there's a lot of upsurge of cancers in our system due to consumption of a number of things, which I'm sure probably we can discuss that later. We need to be very circumspect what we use in managing this pandemic. It needs to be proven. We can't just go wholesale and say that because it's worked for this person or that person, it should work generally for everybody. For instance, in some countries, they tried producing monoclonal antibodies as immunotherapeutic agents for managing COVID-19. But then they realized along the line that it didn't work wholesale for everybody. And this is where the research bit comes in. We need to be very careful and evaluate all these before we apply them.
Okay, right. But because of the dynamics, Roland, I think that we should, so in order not to make people stay on the line for too long and, you know, credit issues in this COVID-19, we take a number of calls and take a number of the questions and then we throw it to you. Benjamin is calling from Gas South. Benjamin, sorry for making you hold for that long. Please go ahead.
Please, my name is...
Your name again?
My name is Benjamin Amankwa. I'm calling from a community called within Gansat region.
No problem. If you have a question, please you can pose them to our experts. On stream.
3 days ago, I've been feeling feverish. I don't know. And I've been coughing down deep down to my heart too. And I'm afraid, and I don't know, maybe.
Okay. Thank you, Ben.
Did you say you're coughing?
Coughing.
Yeah,
and then what else?
And yes, I don't know. There's one thing to, we normally say it in Ghana. I don't know if I've explained it in Ghana.
Go ahead.
Okay, like in Ghana we say tiko and shimmy at the same time coughing too.
Okay.
And I'm feeling feverish. I don't know.
Tiko.
Malaria.
Tiko and fable.
Over there.
It's also
like hiccups. Okay.
Okay, so you're feeling feverish. You're having recurrent hiccups, and then you're coughing, right? Is that all?
A headache.
Yeah.
You have a headache too.
All right. So we go to Ben. Ben. Well, thank you, Ben. Ben from Gansouth. Now let's go to another Ben, Elembele. Yes, please. Please go ahead. You have a question, and that'll be good, so that we pose it to our expert on stream.
Oh, okay. Left to me alone, I think this thing is being politicized. Hello?
Please go ahead.
Left to me alone, I think all these things are being politicized. But I would like to know the stance of the health professionals. And I think what do you call it, the issue of the restriction. Should it be lift, or according to them, how do they want it to be? Because at long last, the whole burden will come upon them when it comes to what do you call it, when it comes to in a
managing the patient,
becomes very critical.
Okay.
Yeah, so I just want to know their stand, whether it should be open or not.
Okay.
All right,
now let's go to Akimodan, where we have Prince. Prince.
Yeah, good morning.
Go ahead, Prince. Good morning.
Yeah, you see, what the doctor said, the question that came before, that, for instance, the Madagascar have found an organic cure, and the response that the second doctor gave. You see, with cautiousness, we all know that even cooking a yam to eat, you need to be cautious about how you prepare it. We all know about that cautious measure that we need to take. What we are saying is that we have come to time of age, that if we call ourselves researchers, doctors, we need to come out with findings that will help us in this country. That is what we are saying. In time, we see our old men and women were having medicines. Plant medicine is the way to go. We need to be dependent on our own. This is the time that you have to put your brain together.
So Prince,
you are doctors.
Right, Prince. If you can make the specific question clear, a bit clear. What's the question?
My question is that why is it that Ghana, we are not finding medicine for some cures, some diseases and sicknesses in this country?
All right.
We have to go beyond depending on the Western countries.
Okay. Well, Prince, your point is made, Prince. Now let's go to Della. Della at Kojo Chrome. Della.
Yeah, good morning.
Morning, sir. You have a question. The question is more appropriate. Please go ahead.
Okay. Special greetings from Dr. Jerry Kwati, or she's watching you guys.
Who is he?
Yeah, a member of NDC COVID team.
Right.
Okay. This living with COVID issue. Seriously, I don't know what they are telling us. I can't really think far. Because how can I live with COVID-19? Is it normal? Has it become like malaria or fever?
Okay.
I don't understand Roland, because
Kojo, do you have a direct question instead of just making commentary?
My question is, how is the money that we receive from IMF disbursed? Because as we speak, when it comes to if you come to Roland, our frontline nurses are being affected.
Okay, so your point is about
all right,
supporting the health institutions to deal with this, and you think that we are not there yet, so we can't live with it. Am I right?
Yes, okay. Of course.
Thank you. Okay, so we'll direct the first question to you, Dr. Owusu Entry. I think that's more appropriate. The psychology of it. We're looking at somebody who is calling from Gun South is having hiccups and...
I'm not sure if it's about the psychology. He's giving us that's why I took my time to write down the symptoms. He talks about feverishness, hiccups, coughing, headache. He's afraid. He wants to find out whether he should get tested. Well, I don't know. Maybe it's psychological.
Dr. Chris, you first, and then we'll go to Dr. Swinchi.
So that is a good question, actually. So because the symptoms he mentions are among symptoms that we look out for those who have symptoms. And yes, I think that he needs to dial the 112 number and speak to somebody. If this is mild, they may not need him to come to hospital. They may actually dispatch somebody from the district to test him and ask him to basically quarantine himself for a while. The other option is, at the end of this, I'll get the COVID Direct number. If there's an app that he can actually access. The University of Ghana Medical Center is set up an app with a team that mans that, and then they would help him directly. So the COVID Direct, which was set up with the assistance sponsorship of pharmacists. We can help him on that. There are a lot of people who are getting through to us on that app at the moment, and we're able to connect them even to health professionals if need be. If there are issues that we think that are significant needs to be tested, then we'll reach out to them. If we need to pick them up, we will reach out to them. So Gifty, at the end of this, what I'll do is actually send you the COVID Direct link, and then you can pass that on to Ben from South.
I hope that you can get it whilst we take the other answers, so that by the time we finish, we can have an answer to share with him on TV. But I think that since we've dealt with the health issue as to exactly what he should do, get tested or something, Dr. Ruth, maybe we'll bring you in at this point. He said he's afraid. So, we know that people experience these symptoms and they, out of fear, stay at home, rather stay at home and share, their thoughts with someone else, or sometimes end up transmitting the virus anyway. How can you help him, to deal with this psychologically, even as he waits to access healthcare?
Yeah, so that is very important. This is the very point that psychosocial support starts, right from the point where the person starts exhibiting any of the symptoms that is suggestive or otherwise of COVID-19. Because right from that point, fear can set in. I would encourage the young man not to be afraid, not to panic, but to calm down. It may not even be COVID, and you would have worried and lost sleep over it for nothing. That is not to say that even if it is COVID, you should lose sleep over it. Now the health team in the country, in all the various regions, are doing their best to care for patients who have tested positive. And when we look at our death rates, we see that it is still very low. That is not to say that even losing a single life is something to be happy about. And so he should hope and keep the faith alive that even if it is COVID, he would get through it. And so until the health team tells him to come for a test or a screening or otherwise, within the waiting period, he should make sure he's eating well, he's sleeping well, he is distracting himself, because every now and then the thoughts may come through your mind uninvitedly that so could this be COVID, could this not be COVID? Try as much as possible to distract yourself, and there are several activities he can do to distract himself. Watch a movie, get in touch with friends via phone or social media or video calls and stay connected. Make sure you're eating well, you're sleeping well, you are keeping your immune system on top in terms of getting good rest as well.
Okay.
And I hope that by so doing, even if it comes out positive, you would have prepared your immune system well to fight the infection. But the important thing is that don't worry, because worrying in itself would compromise your immune system, which will not help with your recovery in case it is COVID. Even if it is not COVID, whatever infection you may be having, you will need good immune system to stay on top of it. And so worrying should not come in at all.
Okay. We'll be wrapping up soon. Dr. Samuel Essien Beidou, I'd like to find out from you. This question keeps coming up, even here on my WhatsApp console. A lot of people are asking what your thoughts are as health professionals regarding easing of restrictions, as a lot of people are envisaging will happen next week. They also think that there's a lot of politicization. So where do you stand when it comes to easing of restrictions based on the facts available to us? Dr. Essien.
So thank you. I don't know what kind of restrictions people are looking at, but as we've
I guess it's social gathering.
As we've clearly stated, once people can adapt well to the tenets provided by the Ghana Health Services on how to manage this infection, I think that we should be okay easing the restrictions. If people can adhere to physical distancing, if people can adhere to washing of hands, wearing of the face mask and all of that, once people can adapt well, I think that we should be able to ease these restrictions and allow the economy to also grow as well. Basically, it's about adaptation. We need people to understand the underlying principles behind these measures that have been put in place. Why is it important to wear a mask? Why is it important to wash your hands? Why is it important to physically distance? Once people understand the principles behind these things, then it will be easier for us to lift whatever restrictions we have put in place to make sure that the economy also doesn't suffer.
Right. Dr. Essien, thank you very much for your thoughts on that one as well. I don't know if I'll be able to take final words from all of you. If you can make it very brief for me. I can't do that. If you can do it very brief for me. I'll start with you, Dr. Owu. Still, the question keeps coming. How can we live with it? What should people take away from this conversation we've had today? Each of you can go for it. We start with Dr. Owu.
Yes, so thank you again, Gifty. So basically, it's important that we reduce infectability, and it's important that we align our health system with other sectors in our other sectors, i.e. economy, education, to be able to move on. It's important that we're mindful that we're going to change how we practice medicine. Do people really need to come to clinic every single time? Are there things that we can do by telemedicine? It's important for us to know that we have to change some things about family life, but that should not destroy the social aspect of our life, but we need to do it more carefully. But one important lesson we've learned from this is that we win when we work together as different sectors and different disciplines. Even in medicine, working together with the different aspects. I've had to work with public health, clinical people, the psychosocial guys, diagnostic. And when we do this, we have bigger impact. And therefore, we need to start planning to put in structures in our system, health system, education system, finance, and all the rest of it to make sure that it works. That is how we're going to be able to live with this. Living with a virus does not mean that we're saying people should get infected. What we're saying is that we're living with other disease conditions, but we are not allowing it to overwhelm what we do as a people. So we're not saying that reduce your guard or lay down your guard. What we're saying is that let's reduce it to the barest minimum, that it is manageable even at every level of our healthcare system. That way, we're able to get through living with us. Gifty, I'm sending you the app through a course, this thing for the COVID Connect, so that you can make that available.
Right.
But you can get it on iOS or Google Play. It's Lucy Vitals, LUSCII. Vitals is VITALS. but I would forward that to Echo right now.
Please do.
So that you can make that available to your audience.
Thank you so
and
much.
we'll have a dedicated team reach out to you when you go through that. Thank you.
Thank you so much, Dr. Owu there. By the way, Echo is a producer, so just so you don't get confused. Let me come to you. I'd love to end with Dr. Ruth. So let me come to you, Dr. Samuel Essien Baidu. Your takeaway, anybody who's listening to this conversation, what should they take away as we prepare to live with this for at least 5 years?
I think this is a very good opportunity for us to rethink our futures in terms of education, in terms of work, everything, the economy. One of the things that has become very evident is the use of technology. Previously, there were people who didn't really bother about the use of technology. But I think that this is a good opportunity for us to relook at our policies and incorporate a lot more technology into our educational system, work environment, our transport system, and everything, so that we can also minimize the extent of contact between people. Basically, we need to adjust in these ways. Our family lives may be impacted in one way or the other until we have a credible vaccine. Our social life may be impacted in one way or the other until we have a credible vaccine. But that notwithstanding, I am sure that we can easily adapt to these new changes that we have. I'm sure we haven't forgotten about HIV when it came up some years ago. It was so difficult to live with. I think gradually we've adjusted to living with HIV, and it's here with us. We don't make a fuss about it like we used to. We just need to adapt to the changing times so that we can live well and happy after.
Very well, Doc. Thank you so much. That's Dr. Samuel Essien Baidu there. Finally, Dr. Ruth Owusu. Doc, what should people take away from your perspective?
Yes, I'll quickly touch on what people have said concerning our views. I would say that if that's mandatory for people to keep all the preventive measures, when I say mandatory, it should be illegal, for instance, for somebody to go out without a mask. It should be illegal for people to operate shops or meet at any gathering without hand sanitizers, without running water, without tissues, without liquid soaps for them to wash their hands. And so as we think of probably whether the government should lift up ban on gathering, in case he does, I am looking at a situation whereby the preventive measures shall become mandatory and legal, with law enforcing agents dispatched all over to ensure that we are keeping these preventive measures. And again, as we move to live with this virus, I want us to keep in mind our connections. I mean, connections make a difference. I have always said that the wording should have been to maintain physical distancing and not necessarily to maintain social distancing, because we can still stay connected socially via several means. And several studies have proven that connecting to people via video and voice is better than just text messages or email. And so let each one of us, as we live with this virus, find means to connect with each other. Don't let us lose our connectedness. We are social beings. And so our social connections must be kept whilst we keep our physical distances.
I mean, that's a great takeaway for me personally. For me, it's all about the mind. Even when you have the disease, it's all about the mind. It's been great talking to you all. I've been having this discussion, of course, with Roland Walker, but we've also had Dr. Samuel Essien Baidu, microbiologist and immunologist at the University of Cape Coast, who joined us. Thank you so much, Doc. We also had Dr. Ruth Owusu, who you just heard. She's head of the psychiatry unit at the Komfo Anokye Teaching Hospital. And then Dr. Christian O. is a consultant anesthesiologist and head of ICU at the Kolebu Teaching Hospital, also University of Ghana Medical Center. He's also the management coordinator of the National COVID-19 Case Management Center. Thank you so much this morning. You've done a great service to all of us as a country. We're grateful.
Well, definitely. And it's where we transition to look at the related issues on actions and activities being undertaken to make sure all of us are able to contain COVID-19. We say good morning to all of you, but we turn our attention to Maxwell Agbagba because there's an ongoing disinfection exercise at the Takoradi Harbour as part of the general national disinfection exercises that have been undertaken the last couple of weeks, still continuing. And Maxwell will bring us up to date. And what do we have, Maxwell? I can see you well strapped in groomed PPE, so to speak. Maxwell
just got into the deep freezer.
I think he's back.
But we can raise Maxwell back surely. And I mean, some of you did send in your text messages. We couldn't read them. Maybe we'll do that whilst we get Maxwell out of the deep freezer at this point. This one says, I would like to know those who have recovered, whether those who have recovered are being put on a specific treatment. They've talked about it. The health professionals have talked about it. They've said that sometimes they allow them to go home to treat it. They have azithromycin, I think, if I'm getting the word right. I think that's the sort of treatment they're giving them. Essentially, there's no vaccine and there's no cure, so we treat the symptoms, and that's what it looks like we do. Mavis is texting from Takwa, says, hi, Roland. My proposal is that 1, health workers who are working to achieve one purpose are at risk of COVID-19. 2, if government will put measures in place to screen all workers of COVID-19, supply us with immune boosters to protect ourselves. And 3, government will put in measures in place to transport nurses to and from work. So these are your thoughts on how we can live with it. You are a health professional, it looks like. You say you are Mavis from Takwa. And Takwa has had its own, problems with COVID-19 recently. It's been spiking up, quite steadily there. Hopefully you work things out over there. This one is a question. Let me see if I have an answer. If not, okay. I think I've already taken it. Okay. So this one is talking about herbal medicine. It says, I'd like to know whether the herbal medicine that the Center for Scientific have proven that it can be used to fight against the pandemic is in use. And if it is in use, how are patients responding to this new herbal medicine discovered in our country? Philip from Takoradi. Philip, I'm not sure that we're using any herbal medicines. As far as I'm concerned, I think the tests are still ongoing. But this is a question we can ask government at the press conference that they organize every week when we get there.
Yeah. And I have to add that the response to that text about the treatment regimen that are being used, the number of drug combinations that are used depending on how efficacious a certain combination is to a particular case, because we don't have the vaccines or the treatment regimen. So they just use a combination, which one that works better for you to recover or manage. That's what it's used. But look, we have to take a break. When we come back, we're putting on the front burner the subject of how Islam is able to manage the related issues of social distancing. Now we're talking fiscal distancing, as we got from Dr. Ruth Owusu-Entwi there. But how is that affecting the practice, and how are the managers and the scholars and the imams in the communities managing this? Up next.